Coronavirus vaccine hesitancy is seeing a rise in the United States, despite the country recently passing a major milestone.
Over 200 million shots. We're saving lives. Keep it up. We got a way to go.
This coming on the heels of those rare reports of blood clots after receiving the Johnson & Johnson vaccine. The CDC and FDA temporarily paused distribution of the vaccine to further investigate, but have since reinstated its use.
CDC, in partnership with FDA, is recommending that administration of the Johnson & Johnson or Janssen vaccine resume. To be clear, we are no longer recommending a pause to the Johnson & Johnson vaccine.
Hesitancy at some level, however, has always been present, especially in the Black community, and that hesitancy is partly rooted in a long history of medical racism and disparities.
I think that fear, for sure, it plays a part, and I also think there's like an underlying sense of like understandable mistrust in terms of like the government and like the medical field as a whole.
Tiffany Moss is a fourth-year clinical psychology student and says that the fear comes from a valid place.
It's valid. It's not coming from nowhere. We have the evidence, right? Like we have the documented history of these things happening. And so I think that even though we can really want people to take the vaccine potentially, and we know like the benefits and things like that, we also have to take into consideration that like our community has valid reasons to have some mistrust.
The legacy of that history is still apparent and glaring, especially in the wake of a global pandemic.
I think anytime there is a shock to the system, such as a pandemic, we expect that shock to the system to exacerbate any inequities that we're already seeing. Prior to the pandemic, we know, as I mentioned, we knew that communities of color have less access to healthcare, are more likely to be uninsured, and just face a lot more structural barriers to getting adequate healthcare compared to their white and wealthier counterparts. So when the pandemic hit, it was shocking, obviously, because this is a pandemic, but it was unsurprising to see these structural inequities being exacerbated to that extent.
Nambi Naduga serves as a policy analyst for the Kaiser Family Foundation and says when one group is subject to disparity, it can affect the larger community.
It may impact reaching herd immunity. It may impact slowing the spread of the virus. And that may result in more hospitalizations within that community. It may result in more deaths and more cases of COVID-19.
Edward Dudley is a pharmacist for a large chain pharmacy and says even he had reservations about getting the COVID vaccine.
I was probably a little apprehensive at first about the vaccines because of the history of how they've been manufactured, the pressure they were getting in from the government to rush them through and whatnot. I finally come to kind of conclusion that the pharmaceutical companies are doing everything that they need to do in order to assure that the vaccines are safe and are effective.
Now Dudley encourages members of his community to get vaccinated and says the benefits outweighs the risks.
There's reason to be skeptical if this was 20 or 30 years ago. But I think now you have to take that out of your mind. And it's better to be safe and sorry. Even if there's side effects, most of the time the side effects are minimal. Most of the time people get through them. Anything is going to be better than you coming down with COVID itself.